Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. In this episode of Community Matters, we are exploring resources by our member community health centers as part of our sexual and reproductive health national project funded by Health Canada. Today, we'll be learning about the Youville Teen Clinic and the other programs that their community health center in Winnipeg is offering. I'm joined by Sian Buhler, a registered nurse authorized prescriber, STBBI, and reproductive health expert, Amy LaBrash, who's a program manager, and Jolene, Osztian, who is a counselor all over in Youville in Winnipeg, Manitoba. How are you all doing today?
Great.
Well. Good. How's the weather in Winnipeg? Because I feel like here we've been blessed and then it was freezing. How are you all doing over there?
It's toasty here now.
Toasty, good. I'm happy.
It's finally warm.
Yes. Yeah.
Finally getting that good weather. Good. Amy, I'll start off with you. Can you tell us a little bit about Youville Community Health Center, the community that you serve, and the programs that you are offering?
Yeah, absolutely. So Youville is a nonprofit community health and social support organization located here on Treaty 1 territory. So we actually have 3 physical locations across Winnipeg. So our community health center specifically provides services to adults and youth age 12 plus that focus on healthcare, sexual and reproductive health care, parenting and family wellness programs, as well as mental health and some system advocacy supports. So our services focus on the whole person and their environment and center on their needs, wants, and goals with an aim to be a collaborative and trauma-informed kind of process at all steps. And so I would say that our community is pretty diverse. We have a lot of folks that are local to kind of our community in St. Vital where we're at, but we do get a lot of newcomers who are, just new to Canada. We have a lot of unhoused relatives who come in on a daily kind of need basis to get things like harm reduction supplies, maybe to use the bathroom, stuff like that. So it's a wide variety of folks. And so I think I touched a little bit on the programs, but because it's a community health organization, we have a lot of different niches that we kind of fill at that organization. So it ranges from mental health to the sexual and reproductive health to family wellness, and a lot of other things in between. So I think that's more or less that in a nutshell. So maybe I'll throw it to Sian.
Yeah, I think for me as a nurse, it's just really breaking down those barriers for the people that I serve. As a sexual health nurse. So yeah, just using my skills and my license to be able to help the people that we serve to get really good, easy, barrier-free healthcare. And Youville's programs really allows us to do that. I don't know if Jolene, if you want to add. Sorry.
No, it's okay.
Yeah, I'll just say at Youville, we have just this huge multidisciplinary team, and I feel like we're able to really tackle all of these different aspects of health, and we really follow the medicine wheel model. So we are not just looking at one area of health. We are looking at the physical, the emotional, social, the mental, all those different components, including the spiritual, because we have a lot of cultural programs as well. And I love that we're able to really address a lot of those different social determinants of health and just kind of come from this wrap around holistic care point of view.
That's amazing, and exactly what a CHC stands for, which is so exciting. And I also should have said at the start that I've been wanting to do an episode with Youville for so long. So I'm really happy that we're having this opportunity through our SRH project, but I was really interested to learn about everything else that you have going on as well. So this is a great opportunity. Sian, why don't I get you to tell us a bit about the teen clinic that I mentioned in the introduction, a bit about why it was created and what need it is responding to, sort of its purpose and the services and supports that are offered to you.
Well, I don't typically work in the teen clinic. I see teens all day, every day. I'd probably leave the creation about teen clinic maybe to Amy. She probably knows a little bit more about that. But for me, I see teens all day, every day at Sian Buhler and at Huddle, because I work at 2 sites that Youville runs. And again, it's just really decreasing barriers to teens. Especially with birth control starts, continuation, like contraception renewals, pregnancy testing, and definitely creating a plan of care if they are pregnant and they want to continue with the pregnancy. And perhaps warm handoffs to other resources, internal consultations. So I feel that I think that Amy will be able to speak more to the creation of it, but definitely I think that's what Youville does. We definitely allow, that barrier-free care. So I don't know, Amy, if you wanted to say anything more about that.
Yeah, absolutely. So this was a good question for me too, because I've been with Youville for 7 years, but our teen clinic predates that by quite a bit. So I took a look through and kind of dug around for our creation story. I was actually able to find the submission that we put in as an organization way back in 2001
Wow.
for the creation of our teen clinic. And so through this document and then also kind of talking to some of the staff that were part of these conversations, it looks like it really was just a response to the community need. So I know that in past years, our teen clinic has had very, very strong ties to the schools in the area. So building that that almost like a direct link to the schools that are kind of closest, like geographically to our sites. And so through that, I think there was a lot of talk at the time that there was a lot of teen pregnancies. And so it was kind of born out of this idea of, well, let's try and open that up and get that contraceptive care kind of in place in a way that is accessible to teens and, is going to be cost effective. And so that's kind of the starting point, but it's evolved into so much more. So, back in the day, we only did contraception starts on Tuesday evenings at Teen Clinic. So this was before we had folks like Sean and myself, who were the sexual reproductive nurse prescribers who can do that every day now. Before it was really contingent on the fact that we had a physician who would come in literally on Tuesdays for 3 hours, and it would all be kind of tied to that role. And then the nurses were really doing that education piece. And so through that, we used to open our doors at, 1 o'clock on a Tuesday, and we'd have like 40, sometimes 20 to 40 people, all wanting to get in for that evening because it was such a like limited resource. And now with the creation of some of these expanded practice roles, we've been able to really open that up and give a lot more kind of robust care all the time, not just on Tuesdays. So that's kind of where it came from. And through that, we also do something really cool, which is our low cost, no cost birth control. So with that, we implemented kind of an in-house dispensing system where folks can come and we kind of work with folks in terms of making sure that that isn't accessible in terms of cost. So still keeping that privacy piece safe, but it's not necessarily a teen taking a prescription to a pharmacy to get that filled, but rather kind of keeping things a little bit more in-house and a little bit more affordable. If they need a box free because things are limited that month, if they can pay $5 for a box of birth control, we kind of make that happen. So that has definitely been something that's been really important to the reach of the services that we have at Teen Clinic. Yeah, I think for me, that's kind of where it all stems from. And then it's really nice to be able to then go back and say, like, wow, we've actually come a long way. It's not just Tuesdays Teen Clinic. It's now something we've integrated, across the week for so many different people to access. Yeah.
That's incredible. And also, like, I think 2001 is so like ahead of your time, right? Like, and I've been learning that more and more with other community health centers that started as, supports for pregnancies and different things that are even like over 50 years old. And so it's so interesting. I also like more on the west side of the country as well. So you're all very like ahead of your time over in Manitoba, which I think, sitting in Ontario, I feel a bit surprised, but it's nice to see that work and that you're continuing to do such amazing work. And Amy, I'll continue with you. What else makes the teen clinic such a unique healthcare setting for young people who are seeking sexual and reproductive health support?
Yeah, I think, for us, pre-COVID, it was very much a one-stop shop. So, folks could come in and it's not just about the sexual and reproductive health piece, but we very much had integrated a lot of mental wellness supports and some other things that were geared towards teens that kind of delved into a bunch of different health, I guess, niches. And so, with COVID, a lot of that got disrupted. And so now we're kind of finding our way back to making that experience, like I said, a more kind of robust with lots of different things added. And so one of the things that we've been able to get off the ground, which I'll let Jolene talk about because she's really been the one spearheading this, is getting our peer counseling program back up and running. And so that also happens in conjunction with Teen Clinic. So it's a space on Tuesday nights where we have, trained peer counselors who really are there to address all needs, not just mental health, but also, spiritual things, the sexual and reproductive health lens. Like there's a bunch of things that they're kind of experienced with to kind of talk about with folks. And so that's what I think really sets us apart in terms of the teen clinic model is just, kind of was born out of this one idea around kind of teen pregnancy, but it's really evolved into something that is, like I said, a one-stop shop for teens. So maybe I'll pass it to Jolene to talk a little bit more about the peer counseling model because she's been the one who's really been at the heart of it this whole time.
Thanks, Amy. Yeah, so in I guess like the last year or so, we decided to kind of bring in this new peer counseling program to address kind of some gaps we had with our mental health counseling program, which wasn't able to continue during the like Tuesday night teen clinics anymore. Um, and so to really like ensure that we still had this space for youth to have a place to talk, to be able to be like very low barrier and also like act kind of as an early intervention, was to have this peer counseling program. And so that just very recently started in the last couple of months. It took about a year to develop. And then from there, we went through a hiring process for volunteers and did several weeks of training with them. So I was like so thankful to work with like so many different members of our team, different disciplines to come in and spend like several hours training these volunteers to be very knowledgeable and informed by all of these different health topics. So these peer counselors, they work with folks who are like age 12 to 21. All of our peer counselors are between the ages of 18 to 25. So it's very much still a peer and just kind of helps like create that more comfortable atmosphere where youth might feel intimidated talking to a provider, but they can come and be like, oh, I can talk to like another youth about these topics. And those peer counselors can then kind of help them connect with resources or other community supports and just be like very responsive to the needs that are coming up for youth today because they are available to book pretty instantly every Tuesday night. You can either like drop in or kind of call in advance to book with them.
Amazing. I know of a couple other health centers that are doing similar stuff, and they've gotten, interesting backlash about the peer-led initiatives and trying to make sure that the peers are running it are like well informed. So it's interesting to hear that you're doing it as well and what you're offering so that everybody feels like the most capable. Because I know if I was their age, I would rather listen to somebody around my age as well, and that would have been extremely helpful. So I completely understand why these programs exist. I think that they're so crucial, which is so exciting to hear. Sean, I'm curious from your perspective, what are some of the biggest sexual reproductive health concerns or trends that you're seeing among youth?
Yes, so actually the Manitoba government has just declared like a public health emergency due to these rising HIV cases. So this has just come out recently. And I think there was like about 320 cases last year in 2025. So I'm not seeing that myself a lot, but I know that that is definitely something that's going on in Manitoba, and especially in Indigenous population, and women under 40 are disproportionately affected. I think with over 50% of cases in females compared to 32% nationally. So I thought I'd just put a little bit of a FYI for Manitoba and the increase in HIV rates. So for me, that is doing a lot of sharing of information, like that is like really peer-reviewed, best practice information. So for example, something as simple as condom use, and I'm seeing some of those trends, like not really wanting to use condoms. So that's been something that has been an eye-opener for me. And really, I'm trying to promote condom use. That's a big thing for me as an STI nurse. I promote condom use a lot. And the other big thing that I'm seeing also is a lot of chlamydia, and especially in my clinic, I'm seeing a lot of chlamydia. And the other thing that I find a little bit concerning is also the talk about consent as well. That is actually been something that I've had to, talk about with my clients. I've only been in community nursing for about 2 years, so it's been a new thing for me to learn about community health and how to talk to kids about this, and especially with consent. So those are the trends, like condom use, consent, and quite a bit of chlamydia. Those are the trends that I'm seeing in my clinic. A lot of ECP use, so really also doing a lot of teaching and information sharing about birth control and ECP use. What ECP is emergency contraception, like what we would call Plan B. And something else that can be kind of concerning is just maybe a reluctance to use hormonal birth control, which, is definitely somebody's right to choose that. But I think that comes from a lot of misinformation from online about hormonal reluctance to use hormonal birth control. So yeah, and really, I just also kind of wanted to share a little bit about Youville and their model and how it allows me to spend time with my clients. So it's not just, a quick 10-minute, 15-minute meeting. It's I'm able to spend an hour, and I can really hear what they're saying. I can listen to what they're saying, and then it allows me to kind of develop that relationship with them. It's really relationship building.
That sounds incredible.
Mm-hmm.
I'm curious, just as a secondary question, do you find, and I know you mentioned it had only been 2 years, but are you finding that the conversations around consent are, or any of these things being changed with like social media use? Because when I only got my cell phone at 13 in the 8th grade, Facebook came out in 2010, and I know I'm aging myself, but I didn't have to worry about maybe clips of certain TV shows like Euphoria impacting the way that I view myself and my sexuality and my behavior and choices. So I'm just curious, even in the 2 years, like, are you finding a lot of the conversations gravitating around those perceptions and how social media or online interactions are impacting? Even, and any of you can answer this question. I'm just so curious.
Mm-hmm. You know what? I'm going to say I'm not very familiar with Euphoria. I've heard about the show.
I can't watch the show because of the content in it. I just see a lot of like racy subject matter online, and it's not a thing that I had to worry about because we weren't online until I was already, almost graduated high school. So I just find it a really interesting thought process that, we're seeing so much conversation about consent online, and how I would wonder how it would impact how people feel hearing discourse and then maybe not having experts until they get to know you all like in their back pocket.
Maybe somebody else can answer this too, but for me, it's definitely, I think girls just don't know. Anybody really just doesn't really know what really consent looks like, or how do I practice consent? How do I talk about that? How do I share what I want? So it's really, they don't really know what it looks like. And so it's really, yeah. So like I've only been like this, been in this for 2 years. So yeah, it's really having to learn how do I help somebody, like empower somebody to be able to say, okay, no, this is not what I want, you know. So yeah, it's a very important conversation. I'm finding that it's actually, it can be kind of related to self-worth. Definitely, you know, how they're feeling. If they feel like they cannot say no, then, you know, they don't, but then they feel very guilty. So it's a lot of self-worth mixed up there. So, but yeah, I'm not sure if Amy or Jolene want to mention anything about consent.
Floor is open if you have anything. If not, I can go to the next one.
Yeah, I would say, oh, sorry,
go ahead,
Jolene.
Amy.
Sorry. I was just gonna say, you know, I used to be in Sean's shoes. Like, before I was in management, I also was a sexual and reproductive health nurse. And so I would say my experience is very similar to Sean, in that, yeah, it's something that I think we have tried with those kind of relationships with the schools, to do more of an upstream approach about like going in and talking about those things in a way that brings it up earlier in, you know, as people are starting to think about their relationship with their own bodies, with sexual and reproductive health, with
Mm-hmm.
partners. And so the other thing that we've tried to do in the past too is also offer, you know, tours at our site as well to kind of demystify some of those, like you said, the misinformations, the things that come up that are trending on social media that don't really, you know, have any basis for how things really are, or how, you know, health
Mm-hmm.
stuff plays out. Like we had one time a rumor going around, it with the youth saying that the only way for guys to get tested for chlamydia and gonorrhea was to get like a urethral sample, like a swab. And so, you know, that was an easy one for us to debunk and say like, no, but it was putting they were scared, right? Like they didn't want to come to get tested because who wants that? Who wants a swab up your urethra? And so it was us doing the work to then say to them, listen, it's just a urine sample, like most of the time. There are other cases, but like it's a quick P test. And to just like spread that kind of information and have them come into the space, and be able to see like what does an exam room look like? Who are the people that are going to be conducting your assessment? Who are the people at the front who are going to greet you? You know, the fact that we have condoms in the vestibule. So if you feel too shy to come in and have a conversation with us, that's okay. Like just come in through the door, grab what you need and go. And just to kind of, like I said, demystify some of those things for those the youth that we have in our community, because there's definitely some interesting things that come up where you know, mistruths are being spread, and it's creating anxiety in a situation where, you know, you already have a lot of worries or
Yeah.
anxiety because it's the fear of the unknown, etc. So anyway,
Mm-hmm.
that's kind of my 2 cents of kind of that lens.
Jolene, did you want to add anything?
Yeah, I was just gonna say, I feel like these kind of conversations around like medical anxiety come up a lot in counseling. And also not just like about medical anxiety, but also about like these core beliefs that people are holding. So we'll end up exploring a lot of that in counseling as well. And I see that coming into my office of these kind of narratives that people are seeing in TV or on the internet are, you know, becoming ingrained into their own beliefs and values that they bring into the world. And while there are certainly times where I think like that has been maybe harmful to some of these people, and so we have to do some work around like education as well as like maybe some anxiety coping skills to really like work through that so they're able to still get the preventative health care that they need. I will say I have found at the same time that euphoria is coming out, there are also lots of more positive examples in the media coming out. Like quite recently, there was a show released on Amazon Prime, no sponsorship here, but um, But they had like amazing conversations around consent, and particularly around consent after sexual assault, not just amongst like, the two partners in the show, but also amongst men in particular, and men in like a highly masculine sports kind of dynamic. And so it was really interesting to see that. And I hope that as I see more of that kind of in media, I see more of that in my space, in the counseling space as well, and also in like the nursing space.
Mm-hmm.
Thank you. Thank you for indulging my random question. Jolene, I'll ask you though as well, how important it is to have these peer support programs in sexual reproductive health, and what aspects of this service have brought significant impact to the teen clinic?
Yeah, I think like we know with youth that it can be super kind of daunting or uncomfortable to have these conversations around sexual and reproductive health. And so having that similar age peer, as I was mentioning earlier, who's informed on these topics, who kind of knows about different like STBBIs, who knows about what the whole process is for testing for PAPs, for like what different birth controls are and how you go about getting a prescription for those. Like this can really help alleviate a lot of that anxiety and awkwardness by having those peers be like their first point of contact, because then they can kind of help break down that stigma, and just sort of help like that emotional aspect that comes up with like asking these questions for the first time. And from there, they can kind of help point them in the right direction. Like we've got peers who can be like, hey, listen, these are some of the options out there, but you know who I think would be really great at helping you figure out what's going to be the best option for you is my good friend Sean here, who's a like sexual health nurse. And so they can kind of have that warm handoff. A lot of times, like in this peer support space, what I feel like you see is that teens are often asking, like, what is normal in relation to their health and well-being, which just often has them turning to the internet or, like we were saying, like those TV shows for answers. And while there are, some like good examples and some good information, I feel like nothing really surpasses having that one-on-one connection with another human being and so it's really important for like our overall well-being and health to be able to share our concerns with somebody else, to have them validated, to have somebody else say like, I see you, I understand where these concerns are coming from. And then to be able to help connect them with like the most knowledgeable and proper resources to get that support that they need. And so I love that our peer counseling and teen clinic programs have been able to connect youth like with these supports very quickly. And we can just kind of like introduce them to like one of our nurses, before they even have to book an appointment. Or like Amy said, they can come in and they can just kind of like tour the space a little bit and see it. So it makes them feel a lot more comfortable. And vice versa, we've actually had like providers who are connecting youth with our peer counselors as well, like youth who are coming in for kind of like some nursing support, and then turns out maybe they have some other stuff going on for them. Maybe they just need like a listening ear, and they can be like, hey, like come meet, all these like cool peer counselors. Maybe one of them can kind of sit and chat with you for a little while as well.
That's so awesome. I think we touched on this a little bit, but I am curious what some of the barriers are that youth are still facing when they're trying to access sexual or reproductive health care and education, and especially in communities where these services do exist, and how Youville is improving that access and diminishing those barriers at this time. Sean, if you I think want to start.
Sure. Well, as a nurse, as STI nurse, I know that sometimes I find some of the barriers are, which doesn't seem like it would be, but is like misinformation online. And so I know as with me and Jolene, we're working together and we're producing these little social media short educational videos. And so, yeah, kind of like peer reviewed, best practice kind of information so that it's, correct information, because that is a barrier. Sometimes I find they come with some very interesting ideas. And so it's just really having to show them, okay. So I think that one of the things that Jolene and I have started doing was one of those short like information videos. Yeah, and also I find a lot of providers that they go to see, the providers are just really not listening to them or really not believing what they're saying. And so that is definitely a barrier. And for Youville, and for me at Youville, Youville allows me to be able to spend time with them, to be able to, be a very holistic nurse and to listen to them. So yeah, I find that Youville's definitely can create those spaces that we can decrease those barriers.
And then Amy, did you have anything that you wanted to add to that question?
Yeah, I was just thinking about this, and I think some of the things that I've noticed lately and some of the things that we've tried to kind of pivot our operations towards is kind of niche things. So like gender affirming care. So that is a huge one where there's finite resources in Manitoba. And so we know the wait times for youth are very long. And so we actually have a nurse practitioner that we work with who is well versed in that and is able to take folks on in certain aspects of providing that care. And we're able to kind of do that in a more timely way. So there's just little pockets of things that we're able to not create a huge amount of capacity, but still be able to tackle it, for the folks that we're seeing regularly, especially if it's something that we know is important to them. So it's kind of like one of those in-house things. We don't necessarily advertise that because we're the floodgates would open. But it's definitely something that we try to be responsive to in terms of the folks who are already kind of walking through our doors and accessing us for other things. And I think, yeah, continuing to have teen focused spaces. So having our Tuesday evenings be teen clinic focused, where we have the peer counselors available. We have a nurse here. We have another sexual and reproductive health nurse named Michelle who does our teen clinic. So she has 4 spots every Tuesday, and trying to kind of also create, bookable slots, but also same day, so that, if there's a teen that needs something, we have the availability for them to walk over after school and be seen potentially that evening. So just trying to always be responsive to what our teens are looking for and creating safe spaces for them to be that are kind of teen oriented. But then also, like I said, kind of creating some more capacity in some of those niche areas that we know are not super easily accessible in Winnipeg.
Amazing. Thank you. And actually a perfect segue into my next question, because I was going to ask if there are particular groups who are still underserved or hard to reach, and if there are any strategies that Youville is using to improve that inclusivity and equity within care as well. Sean, I think if you want to take this one.
Yeah.
I think some of the groups that are still underserved would be our unhoused young adults, unhoused youth, ethnic minorities, and I also find teens from religious backgrounds. But I think some of our strategies, like we try to be responsive, staying open after school. That is a big one. So to be able to fit into their schedule. Peer counseling, like we've talked a lot about peer counseling, that's definitely a good strategy. And we also use our outreach walks as well, where we have a group of people that would go out into the community, give like clean supply, so harm reduction, which is very important. So we do outreach walks on Tuesday nights, and that's where we can kind of let the people that we serve, we can let them know about Huddle and Youville services. So and then also really just understanding, social determinants of health and trying to support the people that we serve on a case-by-case basis.
Right. And Sean, I'm curious too, and we touched on this a little bit, I think, when you're mentioning your, the last 2 years and learning about like speaking to the community in this way. And I was very curious about the language that you use when you have these sensitive conversations around consent, relationships, gender identity, sexuality, and stigma. So how do you talk to the kids, to the youth in a way that resonates with them? And I would like to add, without being like cheesy or cringy, because I would be so worried.
Definitely. I have to really work hard not to be cheesy because, I have to ask my kids constantly. I have 4 kids, so they're young adults and teens. So I have to always ask them, what is this new word? I don't understand it. I just learned a new one yesterday, actually. So I'm like, I'm coming up on the, well, I learned a new word, and then I tell my kids, I just want to be hip. And then they're like, Mom, no. You don't say the word hip.
I'm trying to learn the whole 6-7 thing, and I've been told also to stop. So we try our best with the youth these days, but I don't think I get it either.
Yeah.
Tell us a little bit how you're managing.
I do my best. I think I do a pretty good job because I guess for me, my approach as an STI nurse is really being matter of fact. These kids know they have good BS indicators, right? So I know that for me, the best way to talk to them is just really matter of fact, kind of believe them. And then also my approach is a lot of kindness, softness, and trying to be relatable to them, even though I'm quite a bit older than them. So that is my approach in every kind of connection with any person that I serve. And, really relationship building is a huge thing as well. So being a constant in the community and just relationship building and being open. And again, I'll just stress being kind, because I think sometimes in our society, we're just, there's a lot of unkindness, but really just being kind is it's a really good virtue. And it can get you, it can allow people to feel very comfortable. So yeah, just really approachable, matter of fact, open, kindness, softness. So, and that's how I'll deal with anybody that comes to see me.
That's awesome. And I'm curious, I know we touched on these sort of like warm handoffs, and I also love that about community health centers where, you're either getting that wraparound care approach when you walk in the door, or there is somebody who knows somebody who knows somebody who can help you, and, amazing referral programs. So I'm curious how Youville like holistically provides care if there's overlap with other issues. So someone's coming in for one thing, and then maybe they're indicating something about mental health or substance abuse or homelessness. Whichever of you would like to take this, because I think it touches on all 3 of you, from what I gather.
Yeah, well, as a nurse, if someone comes to see me for STI testing or birth control, and during our conversation something is brought up, then it really is dynamic. It's a dynamic time, and I can if something comes up and they find like they do need help with mental health, then I do have people that I can call upon. And so there's a lot of internal consultations, and I'm always doing a lot of follow-up, and Youville's model allows me to do that just because it takes time, right? It's not like anything quick. It takes a long time. So that's kind of what I think. I'm not sure if Jolene or Amy would like to add to that.
Absolutely. I think like as an organization, we have spent a lot of time developing policies and pathways for connecting across different programs that we offer. Really big with this aim of reducing burden on the individual that we serve to be able to then work with other providers within our organization or across organizations. And so really for us, like whoever is the first point of contact is responsible for helping that person then connect with one of our other programs or providers to kind of meet that holistic healthcare need. And so like our reception team is also a really big part of this. And if we've got somebody who is having to see multiple different providers, they will work hard to make sure that like those appointments are kind of on the same day or like within a similar time frame to help limit the number of visits that that person might have to make to our clinic as well. And I love like how responsive our team is to those needs of our community members and just how supportive we are of each other. So a lot of the time, like if I'm seeing somebody who has indicated that they're looking for some other kind of support, like housing or nursing or whatever it is, I can always like just kind of take a quick walk down the hallway and chat with one of, our nurses, like our nurses or like our housing resource worker, our systems navigation worker, and just kind of get that information from them on like, okay, like what are wait times looking like right now? Or what steps do you need to have like taken place before they come to see you so then I can help support that individual in having everything ready to then be able to do that work with another provider.
Amy, did you want to add anything?
Yeah, I was just going to kind of piggyback onto what Jolene and Sean said. And, with having 3 physical locations, that gets a little bit hard to manage sometimes because we do have people who have kind of specific gifts at each location. But it's really important, like they were saying, to have, distinct pathways on how to get person from point A to point B. And so that's something that we've recently created a kind of a brand new team for. So we now have our advocacy and system navigation team, which is a group of folks that is multidisciplinary. We have nurses, we have social workers, we have housing workers, we have intake. So it's kind of all those folks that have that lens, that advocacy lens coming together and making sure that, again, there's that support for the folks that are doing the work, but then also how do we, like Jolene said, decrease the burden on the folks who are trying to navigate multiple things at once. And so that's been really great to kind of get finalized and have kind of a workflow on, especially for new staff and staff that, maybe don't go to other sites all that often, to know kind of what's available and how to have a kind of standardized efficient process for getting people the care that they need. So yeah, that's been something we've been working really hard on and is something that I think is going to really help sustain the work that we do in a good way for the folks that we serve and our team in general.
And now looking back, are there any moments, stories, or successes from the teen clinic that really stand out to you or are meaningful or impactful? I know, Sean, you mentioned you deal with teens all day, every day. So I'm curious if you wanted to start.
You know what? When sometimes they come in and they're very nervous. You can tell that they're nervous. But as soon as they start talking or I start talking, you can see that they're comfortable. And then afterwards, they'll be like, "Thank you so much for making a very uncomfortable situation comfortable." So for me, those are huge wins because I know then my approach and how I'm doing things is actually working, because that is really what I want to do, is to help empower people to make these important choices and informed decisions for their sexual health. But I think one of the most impactful stories, I'll be really quick with this because I know that time is almost up, but I had this young Indigenous woman that came to see me for just routine testing, but she told me that, and whenever we do routine testing, we also talk a little bit about birth control as well. So she had mentioned to me that she had an contraceptive implant, which, if you don't know what that is, it's a little matchstick sized device that gets inserted into the back of the arm and can stay within that in that arm for 3 years, and it's a really effective form of birth control. So she had that put in, and she had been wanting to have it removed. I set out to find somebody that was going to be able to remove this for her, and so it took me, a little bit of calling around to find somebody that would. And I was able to. And when she came back to see me a couple of months later, she was just very, very thankful that I was able to help her and, on her journey for her self-discovery and healing, and so that is hugely impactful for me, just to know that I was able to help her. But really, just I love it when people tell me that they feel comfortable and they feel very supported by me. So I know that that is something that I'm doing right.
Phenomenal work, Sean, that you did there. I'm very touched and moved by that story, to be honest. As we wrap up, we're at our last couple questions. They happen to typically be my favorite question because I love asking when community health centers need money. I want to get y'all. I just want to get everybody the help that they need to do the amazing work that you're doing. So Amy, I'm curious what increased federal, provincial, or municipal funding would allow your community health center to do. And it can be grand scale community health center. It can be teen clinic specific or SRH specific. But I'm curious as well, if you could change anything in the healthcare system for youth sexual reproductive healthcare, what would you prioritize as well? So what would you do with more money and what would you prioritize in the youth SRH space?
Oh, that's a good question. So much for one. But yeah, I think more money just allows us to obviously have more capacity. And so for me, I think we're doing something right in terms of how we're providing services to community and to teens, creating safe spaces, creating inclusive spaces with staff members who are really able to take the time to get to know and relationship build and create trust. And so that's huge, but we also are a small team and we have finite resources, right? And so I think for us, money would just mean more people doing more beautiful work. I think also we've talked about grand scheme we would love to have a van that we could, do a more outreach with, kind of get a vehicle and outfit it so that we can go out into community and check on, encampments and do that work too, instead of always just kind of waiting for folks to come to us, do more of that, getting out and meeting people where they're at. So I think that is there's a lot more to that but I think capacity and creating more opportunities for us to do the work that we do on a larger scale would be amazing. And then I think for teens, what I would say would be, more capacity, more resources for, those niche things. So things that we know that are stressed to the max. So things like gender affirming care, things like abortion care. There are, only so many resources for teens to access when they're looking for that type of care, and they're often not super easily accessible, or they have extremely long wait times. Same with disordered eating supports. There's a bunch of kind of really kind of like I said, niche things that we do the best we can with in terms of supporting people in our spaces. But I think, with more resources, more money, that would be something that we could, create more capacity for, that we know is a struggle for folks to access on a daily basis.
Absolutely. Thank you. That's super important. And I wish it for your community health center and all the community health centers every episode. Unless there are final thoughts, we're finally at the end of the episode. It's been such an awesome time learning more about Youville. Finally, like I said, this has been on my list, I feel like, for many years. So I'm so excited that I got to learn more about your community health center. And Jolene, I will ask you, if anybody wanted to learn more about Youville Community Health Center, the multiple sites you have, the programs that you're offering, see these awesome fact-checked videos, which I am now going to be resharing on our platform. Where would anybody who's interested in any of this go?
Yeah, if you want to learn more about our community, just be sure to give us a follow on Instagram and Facebook at Youville WPG. You can learn more about our youth center specifically on Instagram and Facebook at Huddle South Central, and to learn more about our outreach walk program, you can find us on Instagram at Echoes Outreach.
Amazing. Perfect. Look at that. She plugged everything. See, this is I knew. I was like, you look like you're hipping into it. You're the perfect person to be a counselor who knows all the
You use the word hip.
Yeah. Hip. I'm just dating myself. But anyway, it was so lovely chatting with all of you. And I honestly, just from the comfort of this conversation, I think that these youth have such a great group of people to bring these concerns to and not feel any shame, any stigma, and they're going to have wonderful properly informed conversations with all three of you. So thank you so much for having this wonderful chat with us, and continue doing the amazing work you're doing.
Thank you.
Thank you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.